I am joined today by somebody who is extremely impressive social entrepreneur, founder, and genuine kind of all-round star changing lives across the country. He is Martin Bisp. Thank you so much for attending today with me and taking part in At the Forefront. Martin is the co-founder and the CEO of Empire Fighting Chance, which is a social enterprise that combines non-combat boxing with immense personal support. Its aim is simple but very powerful: to help young people realize their unique potential. Empire Fighting Chance was started by Martin in Bristol in 2013, so 13 years ago, and it was started as a very small boxing project. It is now something much, much bigger and is addressing youth inequality across the country, as it runs the UK's largest non-contact engagement programme. And Martin and his team have trained over 50 boxing clubs around the UK. This is also something I'm excited to ask him more about later. They are now even reaching communities across the world. So through the programme, young people receive mentoring, therapy and career support, as well as working very closely with the coaches who they build a very trusting relationship with. And along the way, you won't be surprised, they build resilience, discipline, and a much brighter future. At the heart of the organisation is one core idea, that it is changing lives of the people that the organisation engages with, and that is that sport, when it's combined with consistent support, breaks down barriers, and the barriers that are stopping young people from thriving. So, Martin, thank you so much for joining me today. I'd love for you to just give a bit more colour and flavour around what Empire Fighting Chance is doing and why it is so important.
Okay, then. Well, thank you very much. I'll give you a brief overview. So I always start with this. It started by accident. So I don't want, there was no great plan. I ran the Empire Amateur Boxing Club, which was based in inner city Bristol. I started running that from about 1999. 2006, I was waiting. It was a Friday night, and nobody ever wanted to coach on a Friday night. So I used to stop in the gym on the way home from work, kill an hour or so, do the amateurs, and go home. And I was sat in the office talking to what turned out to be my co-founder, Jamie Sanagar. We looked out the window and we saw two young men that we vaguely knew dealing drugs in the park opposite. And truthfully, for reasons that we didn't fully understand, we went over, we had a conversation. We sort of said, look, I think in hindsight, we were fed up with picking needles up in the park. We were fed up with prostitutes accosting people using the gym. We were fed up with addicts in the doorway. And we was like, look, this has to stop. What's going on? And we had a whole conversation about how nobody cared. There was nothing for them to do. And we were like, listen, we care. Got them back into the gym, said the gym's yours, come back whenever you want. Didn't think anything more of it, but they came back on the Monday with 2 friends, 4 friends, 6 friends, 8 friends. And within something like 6 weeks, we had 50 young people coming 5 days a week. So that's kind of where it's come from, really. Go on, sorry.
So, yeah, I mean, you know, like 50 people, that's crazy within such a sort of time. You clearly meeting a massive unmet need there.
Yeah, I mean, it was free, which helps.
Yeah.
But I think the pair of us, to be truthful, we were a bit like, oh, what have we done? So we would do 2 digits to flip a coin for day 3, basically. And that went on for a few weeks, and then a school rang up and it kind of started to build from there. And I suppose in reality, the charity stems from something that happened probably 6 or 7 months after that initial conversation. And we had 2 people sent to us within 2 weeks. One was going to be thrown out of school, and we really didn't understand why. He would hang around at the end, he would tidy the circuits up, he'd sit and have a chat. And eventually we kind of said, what's going on? I just don't understand maths. So when it's I'm going into maths or it's a maths day, I kick off, I do all I can really not to be in class. And so Jamie, my co-founder, sat down and started to design some basic numeracy lessons. If you box 3 rounds and each round with 2 minutes, how many minutes have you boxed, to try and keep them in school? And within 2 weeks, we had someone sent to us that had obvious mental health issues. And with what is breathtaking naivety, I suppose, I rang the school and said, look, they're not naughty, they're not well. 2006, I'm going to stress this. The school was like, look, we don't really care, we want him off site. We're going to give him to you for half a day. And I rang CAMS with what turns out to be breathtaking naivety and tried to book us, can I book him in? Can I have an appointment? And we started talking about crisis points and how he tried to kill himself and that they couldn't see him for X even if he was at crisis point. And we were just so shocked that, you could be at that crisis point and nobody would help you. We decided to do something about it. So that's kind of how Empire Fighting Chance got born. We started to try and tackle the core problem. We didn't care about the symptom. And what we realised is that the boxing was a great tool to engage. So people would come into the gym, they'd feel it's authentic, it's a credible space. They'd want to do the training. They don't always want to box. I mean, I always joke, I wonder for every 20 that come in the gym, maybe one used to box. But what I found is they would hang around, they'd want to train, they'd want to hit the bags. And so we started to realize that we could use the sport to engage. We could underpin it with psychology and eventually therapy. And actually we could make a difference. And that's kind of where it's come from, really.
You are doing something that's clearly incredibly important. But from your perspective, what is it that is so, like, what are the really key parts of what you're doing that make a difference? Is it the providing mental, connecting the young people in with other services? Is it like what for you is the sort of crux of the issue?
I think one of the reasons why we're successful, and I'm going to try to bang the drum for this a little bit, is I think boxing is absolutely brilliantly underrated. It should be a social tool that's used everywhere. We talk about, culturally competent services. We talk about how we can engage young people in different communities. And then we use the phrase, which I don't like at all. We use this phrase, hard to reach. And we say, well, we got these hard to reach young people. But they're not hard to reach because they come through the doors of our gym. And I'd imagine every other boxing gym in the country. So actually, one of the kind of unique ingredients that we provide is a legitimate, authentic boxing space. And also, I'd imagine in almost any inner city community in the world, there's a boxing gym. There might not be a football pitch, a rugby pitch. There's not maybe a rowing club or whatever it might be, but there is a boxing gym. And those boxing gyms are often accessible, cheap. Almost every boxing coach is basically a social worker in disguise. And so what you end up doing is you create an environment where people feel they belong. And so boxing is one of them, and because it's legitimate and authentic and it's credible, we start to get people coming and hanging around and staying. And then we underpin that by the psychology and therapy. So from our point of view, it was about, well, okay, they've been referred for X, but what can we do to make a difference? Can we get them back into school? Can we improve their mental health? Can we get them jobs? Can we help them exit gangs? Can we help them exit urban violence? And so we were thinking, well, what can we do? And we realized that we could underpin those by, so we have a psychologist. We have two programs with it called Box Champions and Box Therapy. Box Champions is psychologically informed, and our psychologist has helped to define the program. I don't know if anybody follows football, but he's Wrexham first team psychologist. So we've got somebody, they were bought by the Hollywood stars. So he kind of, he sort of helped us build something where it's implicit, it's done through conversation, and we're looking to build resilience and help through that. And then the second one is we literally have qualified therapists delivering therapy, but using the boxing as a tool. So we're looking to make that change. So we use the credibility of the sport, legitimacy of sport, and an authentic space, and we underpin it by those things that we hope make a lasting change.
In terms of the results that you have, they're obviously really, really impressive. But how do you measure the difference that you're making as an organisation?
We do it in multiple ways, and we've just switched actually, but we use validated questionnaires. So we use the Short and Warwick Edinburgh, we use the general efficacy scales. And we've also kind of almost measuring, I suppose, those mechanisms of change as well. So we know certain things need to happen. So good attendance is a prerequisite really for the change to occur, because we know some of those longer term outcomes that we've measured, those that come regularly have better longer term outcomes. Those attendance was patchy long term outcomes, and those that didn't attend very often had worse long term outcomes. So it's just stuff like that. And then from our point of view, so we take those ratings, and then we look for external feedback. So we send questionnaires to parents, which we text them, and they can say what they want. We get feedback from schools. We take measurements from schools. So we're trying to collect data from any point in which we might be able to measure, because fundamentally nobody wants to be a busy fool. So if the work's not working, then we need to use that to inform us to be better.
Yeah. And in kind of like zooming out a little bit, in terms of the challenges that are being faced by the young people that you're working with, which are the ones that you think are the biggest challenges? And what do you think is the situation in terms of are they getting worse? Are they being addressed? Is there anything else that is helping them?
Yeah, I think lots of stuff does help. I wouldn't ever claim that we're the only solution. I guess what we see a lot of young people refer to us with mental health difficulties that are struggling to access services. We know that services aren't easy to get to. We know a lot of the time that if you pay, you can access a service. If you can't, then it's a long way. We have seen, and sadly, 4 young people that have used the gym have been killed because Bristol had, you've probably seen there was an increase in issue around knife crime. So we also dealing with kind of gang and urban violence issues. So I'd say mental health's a big problem. Not having culturally competent services are a big issue. We know that support services have been cut. So where maybe they used to get picked up or supported elsewhere, that's not there anymore. So from our point of view, we're trying to match an ever-growing need that seems to have become much more complex since COVID. We're getting many more referrals in, let's say, the last 18 months, 2 years. But mental health would be one that is one of the most prevalent referral reasons.
And who's referring the young people to you? Is it the NHS? Is it their schools, or a massive combination?
Yeah, everybody, parents, self-referrals, schools, CAMS, the police. It could be anybody really. Outreach work. I mean, there's a place in Bristol which is not far from the gym where the gym used to be. That has a kind of front line of young people dealing drugs. So we might go out there and engage them and bring them back into the gym. So we might do the outreach work. We do partnership work with other charities. So we work together in different areas to deliver sort of a combined service. So it could be anybody really.
And from your perspective, do you get support from the local authorities? How are you funded as an organisation?
We don't take money from the local authority. They haven't got any, to be fair, to give away. Yeah. But we get funding in different ways. So we get a lot of grant funding now. In fact, the 4 were probably the first organisation that we were funded by I was working full time for 11 years, I think, and I gave up the day job in 2017 to come over and run the charity. Yeah. And I think you were the first organisation that funded us after I came across, because I had that moment and I was thinking this could be the biggest mistake I've ever made in my life. And then I think we got some money from the 4 and I was like, maybe it might work. So we get lots of grant funding. We do fundraising, so we do events, we have corporate donations, we do team building days that we sell to corporates, and then we charge schools. So every school that uses our service has to pay us. So those are kind of the 3.
Yeah, but that's interesting that you're not funded in any way by local councils and local authorities. And are any of the gyms that you are?
Yes, some are. I mean, my problem with the local authorities is sometimes I look at what they want for what they give you. Yeah. It doesn't make a lot of sense. And I'm like, well, you're going to give me X, like you're going to give me £10,000 and it's going to cost me 25 grand to run the project that you want me to do because you want this, and this. I've got to do this. I've got to go here. And
then I've got to spend 3 weeks writing a report at the end of it.
Absolutely. And then I'm not working with the people that should be working with because you've been so prescriptive that the situation's changed and you haven't. So I tend, we have done some stuff now and again, but also it needs to be better longer term. So I remember that the police have knocked on the door before and said, we've got a problem with X, we got this, we got a gang issue here. Okay, we give you 6 weeks money. Can you do something about it? Well, no, we can. You might as well keep your money because we won't make any difference. So I think it's about finding the partners that work for you and the report is proportionate and what you can do is proportionate.
Yeah. Do you think that policymakers are aware enough or are even trying, are they asking the right questions at the moment around these sorts of issues, both locally or at government level?
Yeah, that's a tricky one because I'd argue to understand it, you have to have lived in these communities or understand these communities. Is very difficult. Also, I think we still are. We used to be the most centralised country in Europe. So actually, we're making decisions about communities that we don't really have a nuanced understanding of. And I would, even a city like Bristol, each community is slightly different. So there's no way from a central position you're going to make, I suspect, the right decisions for Newcastle, Liverpool, London, Manchester, because they're all unique. They've all got unique challenges. They've all got different ways of doing stuff. And I suppose, and there's lots of evidence that backs this up, the kind of hyper-local approach is the one we should be adopting. So the organisations that are on this call, the organisations that are across the UK, those are the ones that we should be investing in, because sometimes communities create their own problems, but they can also solve their own problems.
Yeah.
So what we should be doing is making sure they're sustainable and making sure that we're invested in those types of organisations with proper reporting and proper measurements in order to make the biggest difference.
Yeah. I couldn't agree with you more on that. That is the basis on which the four basically exists and was set up. And yeah, I mean, this is so exciting for me because I remember when we backed you back in 2017, and at that point you were only working in Bristol and you were wanting to do the first expansion into South Wales. And to see you now working in 50 different places across the country it's incredible impact. And I mean, from our perspective, it's such an amazing example of how a local community solution can have nationwide impact by being replicated, but with local partners. Because as you say, you need really strong local knowledge for solving all of these sorts of problems. And as an organization, we believe that communities know how to solve their own problems. They just need some money and some support, potentially with skills, to help with that. So like you couldn't sort of doing my job for me there, Martin. Thanks.
No problem.
But I'd love you to talk a little bit more about what are the platforms that you feel it would be really helpful for you to be on, or for people in your sort of situation where you have got a really efficacious, if that's a word, like successful solution to an issue and something that works, and for you to get heard by the people who it would be useful to be heard by. Are there places that you think, if only I got invited into this sort of thing, or if only the think tanks were, are there places that you think, or people that should be listening to you, that and community leaders like yourself who aren't, and who are they?
Yeah, I mean, everybody should listen to us, really, if they want to solve the problem.
I agree.
If you want to say, look, we want to reduce, I don't know, knife crime. I think they said we want to have a knife crime task, we're going to reduce knife crime. Well, okay, then involve local community leaders and the cities that are most affected by knife crime. Go and have conversations, get them to help set up the response. Like boxing isn't the only answer, but there's some unbelievable work being done in all these different communities, from youth groups through to arts and boxing and whatever else it might be. But how many times are we feeding directly into policy? The number of times you see a policy gets written, and I've been on this, I've done some work internationally. They sit there and they talk about city policies, and I'm like, well, that's great, but for Christ's sake, talk to us.
Yeah.
Because you know what, we're the ones doing the work, and what sounds great in theory is not necessarily the same on the ground. And those conversations and having ways of measuring and piloting and feeding, and it's also about the distribution. So, and this is inevitable, because whether we like it or not, there's still a marketplace. So certain bigger organizations, or like the football band, whatever they might be, they will dominate some of that money that comes from, say, DCMS. But in reality, what we needed to do is to look at what the communities need, and then that money should be sort of distributed proportionately in a way that's still measurable. And maybe this devolution and the regional mayor way is a good way of going. But there needs to be much more place-based investment and place-based feeding into and young people's voices must be heard.
Yeah. You've talked a little bit about this already, but I'd like to just sort of dig into it a little bit more. The difference between the effectiveness of short-term initiatives and what you do, which is generally much more long-term. I'd love you to give us just a bit more flavour on that, and the sorts of short-term initiatives that you see. I mean, rant away, basically, if you like the example about the police coming in and saying, hey, solve knife crime in 6 weeks.
Yeah, and we've got a culture, actually. So, and part of this is like the media cycle, I get it. But we, as a country, take short-term solutions to entrench long-term problems, and then are amazed that we haven't solved them. And so from my point of view, I listen to it and I think, well, that's not going to work, because and sometimes we should take a generational view. There's some work being done in California, and it's about violence reduction. And I know, because I've been dealing with a little bit of them, and they're doing stuff with pregnant mums who have suffered domestic abuse, because they know that could actually affect the way that, and so they're trying to, even at that point, they're looking at generational change. They're not looking at a 12-week project to try and go into an area, do something, and then trying to move out again and be surprised that we haven't made any long-term difference, because it just doesn't work. And for us, like, we're looking at stuff like building resilience, and resilience, and again, it's how you phrase it, but we're not talking about every day is a good day. We're talking about showing up when it's a bad day. It's about walking through the gym when everything's gone wrong. That's kind of resilience. And we can build resilience using the boxing through mastery. So by mastering a technique, you can start to build resilience. That takes weeks and months. It can't be done in 6 weeks. And we're also talking about, we could be talking about young people that might have gone through generational criminality, generational joblessness. They could have mental health, they could have trauma issues. What on earth are we going to do with short-term solutions? We're not really we're not setting them up to succeed, are we? We're actually saying we want to count some numbers and we want to try and move on. We tend to turn money down if it's not longer term. And it's probably why it took us longer to get going and to turn up opportunity. But we always felt like, what did I care? What I wanted is the next young person to walk through the doors of the gym to get the best possible chance. That's what I cared about. And if I can't do that, then I start to question why I'm doing it. So for me, all the things that we see, you need to be consistent. And, people aren't consistent. So they might come for 3 weeks. Something goes wrong, they can't come for 2. Something's happened at home, they can't turn up. And if you're doing a 6-week program, that's it. You've done 2 weeks or 3 weeks. And then you've lost them. And then they're gone to something else. So that never strikes me as the best way of any of these things.
Yeah. I mean, it seems in some ways completely crazy that anyone could think that really short-term stuff will have a lasting impact. You would never suggest, 6 weeks of parenting and then you're done.
Well, that might seem nice.
Yeah. Yes, I do know what you mean there sometimes. But yeah, I'd love you to give us a specific case study as just talk about one of your happiest stories. When you're having a really bad day, who is the person that you think of and you think, what we're doing is worth it because I always remember this person?
Yeah, I won't. I'll give an example of a good story, but I won't name an individual.
Yeah. Please don't name names.
But I can name the individual for the story. But I think from my point of view, we employ, I don't know what it is, 30%, 25% of the staff have come through the program. So when I'm having a bad day, I'll go and sit with one of them because that reminds me why I did it.
Yeah.
And whether they're working in fundraising, whether they're working in a coaching team, I'll go and just spend 10 minutes talking nonsense with them, and it makes me realize why I did it because I remember why they came in. I remember when they came in. And I look at them now and I think to myself, yeah, this is all worth it in the end. But a good example, I think, of one that I've got a couple, but I'll pick on Serena because she's just been given a British Empire medal. So she was referred to us at 16. Was struggling in school. Her brother had passed away and she was struggling with the anger. School didn't really know what to do with her. So she came to us for work experience. One of my coaches spoke to her and Aaron, not only did he help coach, but he came to see me and said, look, I think you should talk to her because this is what she wants to do for a job. So we went to speak to her and she was in college and we said, okay, well, I'll tell you what we'll do. We can give you some part-time work here if you keep doing X, Y, and Z. So 5-6 years later, maybe, she has fed into the Lisa Nandes Youth Advisory strategy. We had Idris Elba's manager at the gym. I remember this, and he brought his son because he'd got his dates mixed up and thought his son was supposed to be in school. And so Serena sort of rocked into the thing and said, I don't want to hang around with your dad in this boring meeting. Why don't you come and do something with me? Had no idea who he was. Took the young man out, did some pads with him. And then 2 weeks later, I get a phone call to say, look, we've got an audience with the king. And I think we should invite Serena. So just from doing that little bit, then she went and sat. And we got a fantastic photo of her in the gym where it's King Charles, Idris Elba, and Serena. And then they said, we're going to do this thing called a youth strategy. And we make a point really of we say you've got to be yourself in these spaces. If they invite you to the table, somebody wants to tell you you've got the power. Don't try and change, be you.
Yeah.
And they said, we've got this youth advisory. And she went, I bet you haven't asked any young people. And there was a kind of silence. And they said, well, you haven't, have you? Who have you asked? And then that went from there to the strategy becoming that. And then she was part of it. So she's gone from not really knowing where she is to campaigning for policy change, working for us, working with young people that are involved in urban violence on the street, and then going to Parliament and demanding change. So that's just an example of what's possible.
That's as someone's just put in the chat, that is a brilliant story. It also relates to somebody else's question in the chat, which was Mark from Different Noise is really interested to hear to what extent the young people who you work with feel empowered to have their voices heard, and what are the barriers they are experiencing to this?
I mean, the barriers, well, one, nobody listens to them. let's be frank, they're not spoken to. And the second one, and we bear in mind, I suppose this is a thing that we deal with, is like almost like a class issue, that they're not expecting their voices to be heard. That's one thing that Sweden keeps saying. She can't believe, she keeps saying, I'm a young black woman, I shouldn't have a voice. And that's quite sad that that's kind of how she thought. I shouldn't have a voice. We encourage them to be themselves in every situation. So from our point of view, like I said, if you're at the table, you've got the power. Don't try and fit in with somebody else. Get your point across. Be who you are. Be authentic. That's all you can be. If you want change, you're going to have to make that change by being you. And then we do have a lot of stuff. We have a youth advisory group. We capture the youth voice stuff, and we use that to feed in. But the youth advisory group recently designed. We've had a new annex on the gym, and they've designed the decor for it. So they put all the design, the pictures, and the whole thing has been designed by them. So, and what I also like is that the young people that have been through the program do not care about hierarchy. So if they're not happy about something, they'll knock on my door and they'll demand that we do something different. Sometimes if you bring people in and oh my God, there's the boss, we can't do this, we can't. They don't care. If they're not happy, they'll come in and they'll hold people to account. So in some ways, the best way we can be honest is by keep employing people who have been through the program and keep employing people who feel empowered to have those conversations with us and don't care who we are. They come forward and say, we need to be better. And then we listen to them, well, when we can.
With what you're doing, you have scaled it to sort of go back to the bigger organizational picture. You have scaled it incredibly successfully. I know there are lots of people on this call who are also running organizations, and I'd love to ask you a little bit about the process of how you've scaled and what were the biggest challenges to it, and anything that you've learned.
Yeah, I mean, I think there was one of the drivers, we were getting pressure to scale as Bristol became better known. And then, as you know, we got some requests from South Wales, so it started to grow. I think for me, one of the issues I had, and I had phone calls from different cities, actually. I remember they were saying, look, do you want to come and work here? And I was like, well, no, what do I know about Newcastle? I just don't know anything about it. I don't know your transport system. I got no contacts. I got no cultural capital there. How on earth could I work in Newcastle and do a decent job? And then have this real thing, and maybe it comes from how I would feel if somebody tried to set up a gym 10 minutes from me. Imagine rocking up 6 hours away in the car or whatever and going, right, I know you've been here 100 years and you've done a fabulous job. Yeah, but don't worry about that because Empire Fighting Chance are here now and we're going to sort your problems out. At best, that's naive. At worst, it's breathtakingly arrogant. And so I was always like, I'm not going to do it. And then one day a funder just said, well, if we had a small pot, what would you do? And I said, well, what I'd love to do is train boxing clubs for free. I'd love to train them and then give them the opportunity to develop it and adapt it for the local context. And they kind of went, all right, we've got some money. Let's try that. So from my point of view, I always wanted to add boxing. I know but boxing's been good to me. I see the effect that boxing can have. I see the difference it can make in young people that don't necessarily have to come through the program. And I also see boxing club coaches who do it for nothing. I was one of those that 3 days a week you're traveling all around the country taking some young man or woman to box in the middle of nowhere. You get back at 2 a.m, you have 4 hours sleep, and then you have to get up and go to work, never getting a penny for it. So I knew the kind of work they did. And I also thought to myself that if we could get the right clubs involved, we could make a difference, because we could give. So what we do is we train them, they get our program, and they're supported for 12 months. And we don't charge them at all. We fundraise for the work, so they're not charged. So what we're trying to do is upskill those organizations. And don't get me wrong, we've probably got a few boxing. Well, we probably have actually looking at Sweet Science and Tattoo. So we've probably got some boxing people on the call here. But they're not always well organized. We've been to gyms when they go, yeah, we collect data. Then they open a cupboard and it's full the ceiling with paper. And you're like, yeah, okay, what are we going to do with this? So we've had to build in the resilience to be able to collect data to talk about impact. But the clubs have worked with, and we only count those that the most mature in their process. So the last 3 years they've worked with over 21,000 people, but they've also raised something like £6 million. So not just change, it's sustainable change, and that's important, because if we shut tomorrow, those organisations could still continue. They've still got the programme, they've still been mentored, they're still raising money. So they're no longer dependent on us, and they can adapt it for the local context. It's not about you have to be this and you have to call yourself this. It's about saying, you've been doing fabulous work for 10, 15, 20, 120 years in this community. This is what we think we can give you. If you're interested, then we can do it. And then 2 years ago, we became partners of Matchroom Boxing. which is, I don't know how people, but they're kind of probably the biggest sports promotion brand maybe in the world, but the Eddie and Barry Hearn and stuff. So they supported the program, and we've been using some of Matchroom Stardust to amplify the message. But it's very much about, you're the experts. This is the model. If you do these things, we know it works. But now it's up to you to adapt it and make sure it's right for the local context, really.
Mm. We've had an additional question about your impact. You're talking just about data collection and data collection, and saying Steph, who works at a small school, and we do some pretty special things in personal development, but we struggle to get the evidence other than through case studies. How do you collect data around that?
I always get the name of this form wrong. It's either it could be GSE. There's two. So we collect the SWEM stuff. So that's about the well-being, and then there's also it's a general efficacy scale we collect. So again, what we're looking to do is we use that in order to create an argument that we've made a difference. But we can also do it for us. It can be simple stuff like we can measure school. It might be school grades. It might be them exiting criminal behaviours. But a lot of the time, those two scales we can use. And the SWEM stuff, I think you can create a social return on investment on. So again, if you want to talk government language, you can start to convert it. The efficacy scale, you can't really do that. By all accounts, a lot of the decisions now are being made, and I don't know whether the four are looking at this, but they're talking about the ONS scale of life satisfaction. And that seems to be a big driver for lots of ones. So that could be something.
Yeah, I was about to mention this, although unfortunately, Steph, I'm afraid it's not available to anyone yet except our 4 portfolio charities. So at the moment, it's only available for charities that we've backed, but we are piloting a digital kind of touch of the button economic value tool at the moment, which, Martin, if you are interested in, we'd love to share with you. So basically, it's a survey. You get each charity, you get your own dashboard where you can see the results of the survey that you give to the young people that you work with. We are having it at the moment, it's adults only, but it's being designed at the moment so it can be extended to work with young people, and it's on well-being. And then you get, so the change in well-being score, then because of the Treasury have put a pound value on well-being, you then get £1 of economic value that you've created if you have managed to improve the well-being of the young people you're working with. And yet we are at the fore. We are, for anyone listening, it is the plan is that we will make this available to the whole of the sector. But it's just we're having it costed at the moment to how we could share that technology and how much it will cost, and then we need to raise the money for it. So it's in process, but yeah, hopefully that will be really helpful, because exactly as you point out, Martin, it's really difficult to engage with a lot of stakeholders if you can't speak the language, basically. And this tool is all based on Treasury backed methods, so it hopefully would help with that. But it's a general problem that charities face, I think. In terms of Martin, what you're doing globally, I'm really excited to see you're working in Canada and California and Colombia. Tell us a bit more about that.
Again, there's a theme here. That was sort of off by accident. So we had a young man that came to us at 14 that was killed as part of this Bristol postcode war thing. But he'd been with us for 4 years. He was a kid that we cared for. He was a kid that we loved, And when there were 2 things that really grinded with me. One of them was a narrative like, well, he's a young black kid from an inner city community type thing, that these things are inevitable. And it's not what's said, but there's that kind of bigger picture piece. And then also it was just, I wanted more change, and I started to push a bit, and I got invited to take part in a Brookings Institute United Nations working group thing about the SDG 16, about the safe and peaceful cities, whatever it's called. I was there, and I joke about it now, but you've got this creeping death and you have to introduce yourselves as a group. And I thought, well, the first person's going to go and they're going to be the worst, and then it should get easier. But as they went around the room, and I think the first person spoke, and he'd set a load of violence reduction strategies for President Obama, and then the next one spoke, and he said, "Oh yeah, I spent 14 years working with Nelson Mandela. Then I went back to Medellin post Escobar to make the city safer." Let's go around the room, and I'm thinking, what am I going to say? And in the end, I thought, well, I'm going to blank this because no, they're all going to be too polite to say anything. So I went, "I'm Martin, as you all know, I run Empire Fighting Chance." I thought, please let that be it. And they were like, "Oh, okay." And then they carried on. So I thought, I've got away with this. And he said something from Santiago, from Medellin. He said something. And I said, "Well, look, that's great in theory, but I'm not sure I agree. And this is why." And then we had a bit of a back and forth. And he said, "But I'm really interested in this. Can we keep talking?" So every couple of weeks, for probably 6 months, we met online, and he was explaining how they'd moved the institutions to make the city safer and what they tried to do. And in the end, he said, "Why don't you come to the Columbia, bring a team out and spend a week with us and see how we've done stuff?" So we took a team out, spent a week there. And during that week, we've met a couple of people who I'd kind of met previously in the UK, but I didn't really get the connection, that were part of a global network, and they'd come to spend some time with us. And then at the end of it, they said, "Well, would you like to join Peace in Our Cities, which is like a global network trying to reduce urban violence by 50% by 2030?" And they explained more. And I was like, "Yeah, that sounds fabulous." And then since then, the idea is there's lots of exchanges. So you're learning from other cities. You're trying to see how you can do things better. What can I do to improve? What can I steal and adapt for Bristol that just makes us slightly better? What can I do to stop another young person dying? You keep pushing to be better. And Canada in Edmonton, the lady who runs a really phenomenal Office of Violence Prevention out there said, "I really love what you're doing. Would you come and work for us?" And so we went out, we trained 8 organisations, 3 Indigenous population organisations, we supported them. And now all 8 organisations have just got 5 years federal government money. So they built the programme in, and now it's going to last for at least 5 years in Edmonton. And it's kind of been through that. And then, what happens, word of mouth gets around, and a couple of other American cities that are well known for the boxing have reached out. So we're having multiple conversations about what might be possible. But it has to be about finding the right partners, and we're training them. It's not about us creating anything else. So I can see we can add to it. If I think we can add to an ecosystem, and I think we can complement what's there, and I think there's good partners who want to be part of what we're doing, then that's great. And that's fabulous. And we can see if we can make it work. What I've got no intention of doing is rocking up anywhere, creating something that's not wanted or competes with existing community-based organizations. So if we can add and we can complement and we can partner, fabulous. If we can't, then it's not really for us. Because I still remember how I would feel when I was trying to get this off the ground, and we were trying to deal with things we didn't know. We had to collect impact. We didn't even know you could get grants at the beginning. We just didn't have a clue. And so we've come that way, and I'm kind of conscious that that's because of the community. That's because we had we've been in the community 50, 60 years. People trusted us. It's important. It's important to me that local film. It's important to me that we add stuff into those communities, not take away.
This is so incredible. You're a global influencer now. Next thing you'll be at Davos,
That's a bit
Martin.
strong. That's a bit strong.
It's so exciting that you are talking to people in Colombia, talking to people in Canada, and training people to have the similar program to what you're doing that all started in Bristol. It's brilliant. If you were to look back on everything that's happened since 2013, are there things that you think if could have made it easier? Are there were there things that actually, there were certain bits that were really much harder than they need to have been if we had been introduced to this person sooner, or if we'd had this skill sooner, or if we'd had this money? Are there any things that, as kind of this is for me personally, but also with what we're trying to do at the Fore, with trying to help other organizations achieve what you're achieving? Our goal is for Exceptional Solutions to get from grassroots to nationwide impact in 5 years, but I'm feeling now we should change it to global impact. But what are the things, or are there any obvious things that you think, that was so much harder than it should have been?
Yeah, it sounds great for 45 minutes, but honestly, we made every mistake going. We didn't know what we were doing. We didn't know you could get grants. We didn't know anything about charities. I didn't think I even want to be a charity to start with, to be truthful. I guess we've been really lucky. We've had good people throughout our journey that have always been there. Almost, it's like that thing where you need it and they appear. So Like, for example, we were in a gym and we've been in the gym in Simple, been there for about 40 years. The landlord had a quadruple art bypass, was going to sell. Gave us first refusal. We got Sport England down. I thought, this is perfect. I swear, he had 11 roofs. 8 were leaking on the day we showed the Sport England round. And they went, there is no way we're ever going to fund this. You've got to fund something else. And Bristol just had the first elected mayor who happened to, I bumped into an urban sport exhibition. I said, look, you should come to the gym. And then he said, well, there's a community asset transfer process. There's 2 or 3. Why don't you apply and see if you can get one? Just by dumb luck that we were featured, the boxing club was featured in the exhibition and he turned up. So we built a relationship, not knowing that he was going to go on to become mayor. And then I remember we moved into the gym and it was fabulous. We'd renovated it. And then 2 big funders turned us down at panel and we should have got both. And we went for a period, like Jamie was saying to me, my co-founder, he was saying that we should just quit. What's the point? We've done all this work and we can't get a penny. And then my wife was saying, this is madness. You're working all day, you're coming home, you're writing a bid, you're going to this stupid boxing club every hour God sends, being taken up with this. What's the point? But we had collected data, and that was the one thing we had. And I just, because I was an analyst before and I was seeing it and I was thinking, well, it does work. And then out of the blue, somebody from the National Lottery rang up who was locally based, said, like, I really like what you're doing. I've seen you put an application in. I think you could just change it and we can give you some, you'd stand a really good chance of getting the money. So all the way through, we just had luck. But we put ourselves out there. We invite everybody to the gym. We talk to everybody, whether they're politicians, councillors, local community. We get everybody in the gym. I would say, and what I say to the boxing clubs is we try and shortcut all our problems now. So we say, these are the things we got wrong. Don't do them. So make sure you invite me to the gym. Don't be insular. Make sure you collect your data from the beginning. Make sure you contact and speak to everybody who might have money before you put an application in, because that massively increases your chances of being successful. And all those things that we didn't know at the beginning are the things that would have made it a lot easier.
Yeah. We'll note down all of those things and see if we can also disseminate them amongst the organisations that we're supporting, to make sure hopefully it can be a bit easier. I'm just checking in the chat to see are there any pressing questions that so yeah, we've got some more. Anthony Clayton's asking, do you ever use comparison with control groups who don't get the intervention? Interesting question.
Yeah, it is a good question. It's something that morally we struggle with. So we did a pilot randomized control trial. But the idea of having a group of people that need your support, young people that desperately need your support, that you then won't give your support to, is something that we're quite uncomfortable with. So the honest answer is we didn't and haven't really done that. Yeah. We've tried to use extrapolation, and I think there's ways that you can probably find matching characteristics. We're talking to a couple of universities at the moment about what might be possible. It just sits uneasy with me, really, that somebody might need your help and you're going, look, you're going to have to wait for 6 months to prove that things can get worse for you. So it's something that I struggle with morally.
Yeah. We've got a question from Kafayat Adio, who's asking, and apologize if I haven't pronounced that correctly, I'm a youth transition worker currently working with young disabled students transitioning through education and other social challenges, and is wondering whether your programs could be adapted to support young people with physical disabilities or learning disabilities so they could fully engage.
Yes, is the answer. We've done classes for young people that have been in wheelchairs or, severely autistic, for example, and haven't been able to do that. We actually built a little therapy gym on the back of the annex so they can get the experience of feeling like they're part of the main gym and they can walk through to a space that's quieter, especially for those that are neurodivergent. Certain things obviously are difficult, but we can adapt sessions. And the punch bags hang low. So we have people in wheelchairs that come and hit the bags and take part in that kind of stuff as well.
We've also got somebody here asking about South America and saying the model is well aligned with the Brazilian healthcare model. I'm not sure if that is something that's of interest. Is there anyone? We are now at time. We've got one last question on the chat, so let's do this one and then I will wrap up because we do try and keep these sessions to time. But do you get any pushback from funders when you work with schools saying that the schools should be providing what you do, and if so, how do you respond to that? That's from Nathan.
Not really. I mean, what the main problem we get, the push from funders is always you need to diversify your income.
Yeah.
So where if they complained about anything, I'd say, well, for 6 months you've been telling me I had to diversify my income. Now I'm bringing a new income, so you tell me I shouldn't do that. So yeah, we tend not to get pushback from that. I mean, obviously, we had pushback from schools at the beginning about using boxing. That took a lot of pushing. And I remember head teachers used to say to me, so you want me to give you the young people that we're struggling with, and you're going to teach them how to fight?
Yeah.
And I used to say, no, we're obviously going to be working, we're going to do this, and I guarantee, you know, that I'll do this. And we had to do sessions for free at the beginning. But we don't have much pushback from funders about charging schools.
That's interesting. And interesting that the schools were worried that you were going to be doing the opposite of what you do in terms of attitudes to violence. But Martin, thank you so much indeed. As somebody has just put in, it's a truly inspiring presentation. More power to your gloves. But if you were to have the chance to say kind of now, which you do, one call to action to people listening, or is there one thing that people could do to help you with your mission, what would it be to finish?
Also to help with, although if there's any boxing clubs that want to be part of the network, send us an email. I think from not so much our mission, but I think our individual missions, fundamentally, what this has taught me is we can actually make a difference. You can be a small boxing club without a clue in Bristol, run by two idiots. And look what we've done. It is absolutely possible to make a change. It is possible to fight for those that nobody are fighting for. It's possible to make a difference. And so you've just got to keep going. And we've had some dark moments. We thought we were going to run out of money. Things haven't worked, but we've managed to find a way through. And when I look at communities all over the country, there's unbelievable work being done by the most incredible people. So I guess my bit would be just keep fighting, keep pushing, because we are doing stuff that's saving lives, all of us.
Martin, thank you so much. I can't add anything that is going to be anywhere near as inspiring as that message. We at the Four are incredibly proud to have been able to give you some support and to be able to give you a bit of a platform here to talk about what you're doing. Please keep doing it. Thank you from the UK as a whole for everything you're doing for some of our least supported members of society, and hopefully they feel like they have more chances than they would otherwise have done. Have a lovely weekend. Again, thank you so much for your time, and thank you everyone for listening. We will forward you the chat, Martin, because it's got some really lovely messages in it, including up the Rovers.
There's got to be a few of us, because life's not easy being a Rovers fan, I can tell you.
Thank you so much.
Thank you. Take care.
Goodbye, everybody. Bye. Thank you.